Why remove the breast if it can be preserved? Breast cancer and the incidence of breast cancer is rising. I do feel that every woman has a right to look beautiful. Even if nobody is seeing, she's always seeing herself in the mirror. Whenever we think of any breast disease, the first name which comes to our mind is breast cancer. The fear of breast cancer is so much. All of us have had some friend or relative or a close relative who has suffered from breast cancer. We are so scared. Why are we so scared of breast cancer? Is it something to be scared of? Yes and no. Why should we be scared? Because you see, what's happened in India is that the risk of breast cancer and the incidence of breast cancer is rising, and we are having more cases of breast cancer than we had before. Should we be scared? No. It's a curable malignancy, and if we detect breast cancer early in time, we can definitely cure breast cancer, and the response to treatment is very good. So there is no need to be so scared of breast cancer as we are usually. We should all be aware that all of us are at high risk for getting breast cancer, all women. So we need to monitor ourselves, we need to monitor our breasts, and we need to do constant examination and timely screening, and only when breast cancer detected early is a perfectly curable disease. Usually when we talk of breast cancer, we associate breast cancer with a lump. Are all lumps cancerous? Because people are so afraid, they get so anxious when they get a lump. No, most of the breast cancer lumps are not cancerous at all. They are benign breast lumps. So why do these lumps appear? These lumps are appearing as a result of hormonal actions on our breast tissue. So as a result of the hormones acting on a breast gland, sometimes the glands will get enlarged. Sometimes there will be some cysts like balloons. These are the things which we feel outside like as if they are lumps. They are very, very common, especially in young girls of around 15 years, 16 years, women in reproductive age, 30s, 40s. All we need to do is keep them under ultrasound follow-up. Sometimes some of these lumps, they tend to become a little bigger in size. They have a tendency to become larger. Yes, in this kind of situation, we do need to remove these lumps. In our breast division in Amrita hospitals, we are offering scarless or hidden scar surgeries for all these patients, because most of these patients are young and they do not want their breasts to be having any scars. And some of the patients who are having these lumps which are likely to become larger in future, we are removing these breasts with most cosmetic and aesthetic techniques. Suppose a person comes to me with breast lump, what we do is we do something called triple assessment. We clinically examine the patient and then we send the patient for radiology. What do we do in radiology? We do a 3D tomosynthesis. We have got a 3D tomosynthesis in our institute. What it does is gives us a 3D image of a breast. So there are small lumps which are sometimes cancerous, which may not be detected by a normal routine mammogram, which is being done in most of the places. A 3D tomosynthesis or three-dimensional picture of the breast will definitely be able to find these small lesions. And when we find these small lesions, what we do is we are doing an ultrasound, and after that we are doing biopsy from these lesions, and we are doing biopsies under ultrasound guidance. So we just go exactly and see where the lesion is, and we take a thick core biopsy, a needle with a thick needle, we take a core biopsy of these lesions which are suspicious only on mammogram and ultrasound. Most of the lesions which are not looking suspicious, we do not even take a biopsy. We just keep these young patients under follow-up. That is enough for them. They do not need any surgery. And let me remind you and repeat it, we do not advocate unnecessary surgery for any lumps in the breast which do not need surgery. So benign lumps can be followed up very comfortably on ultrasound. Now coming to the cancerous lumps, so we take this core biopsies from the lump, we go under ultrasound guidance and we go directly into the lump under the probe, and we take a small core of tissue. This tissue we do histopathology, and then we also do some specialized studies like immunohistochemistry. These studies will tell us exactly what type of tumor it is, and how is it likely to behave in future in that patient's body, or how sensitive that tumor is to hormones and how sensitive that tumor is to chemotherapy. Based on these immunohistochemistry findings, we plan the surgery for that patient. Mostly stage 1 and stage 2 cancers, which are limited to breast and maybe little bit into the axilla, have got above 90% cure rate. So all these patients who are treated in time get cured of breast cancer, and they only need to take some hormone medicines and do a regular follow-up. So it is not a life-threatening disease, but if they are neglected and the tumors become big and they go beyond the breast and axilla to the body, yes, definitely in these cases we have to get worried about these patients. But why need to go to that stage when treatment can be done before? So once we have the diagnosis of breast cancer, what are the surgical options which are available to the patient? Options are, we can remove the breast or we can conserve the breast. Breast conservation surgeries mean we only remove the lump with a tissue of normal breast around it, and at the time of surgery we subject it to pathology and we check whether the tumor has come out completely and there is a normal margin of a normal breast tissue around it, and this is called breast conservation. We also at the same time address the axilla and we see whether there are nodes or not. A lot of patients have a lot of doubts in their mind that mastectomy is better. So I want to clarify one doubt, that is, since 1994 a lot of research has been done in this matter, and it has been proved beyond doubt that removal of the breast is not better or safer than preservation of the breast. And removal of the breast does not guarantee anything that breast cancer will not come back. The results, survival and breast cancer free survival in both are same. This is only for early breast cancers. Early breast cancers mean the lump is only in the breast and maybe some nodes have gone into the armpit. So when we do breast conservation, we remove the lump and we just see the nodes in the armpit. And now in our institution we have got trained oncoplastic breast surgeons and we have very good surgical team. So what we do is we use plastic surgery techniques to remove these lumps and remold and reshape the breast. So the breast actually looks better after conservation than it would look without conservation, and it looks better than the opposite breast also. So these are new techniques which gives us a better cosmesis. So the options is either remove the breast or preserve the breast, which has shown to have the same survival as removal of the breast, and the third option is to reconstruct the breast. So we can also use the skin of the back or in the abdomen, the tummy flap or big buttock skin to remake the breast, get that skin there and use macrovascular anastomosis to recreate the breast, or we can also recreate the breast by putting implants and expanders. So these are all the options. For patients who have already undergone mastectomy, we can offer them secondary reconstruction. So there is hope for everybody. And another thing I want to stress on this point is that patients who undergo conservation are not at a disadvantage from the patients who undergo mastectomy. Actually, the recent research in the past 5 years has shown that breast conservation has a better survival than mastectomy. Because in breast conservation, in addition to surgery, we are also giving radiation to the patient, and it also addresses the entire breast. So this is one of the doubts which comes to most of the patients' mind, that they want breast removal for peace of mind, is actually an illusion, because removal of the breast is not guaranteeing anything for early breast cancers. Another issue with breast cancer is that women are scared that their arm will develop edema. What happens is that the cancer cells go to the armpit lymph nodes. When we remove these lymph nodes, the lymph flow from the arm gets blocked and arms can get edematous and thick. We have got sentinel lymph node mapping facilities in our institution. So whenever there is a node which is not looking suspicious, normal looking nodes, we map to sentinel lymph node mapping, and with a gamma probe we just remove the lobes which are involved, and if they are not showing cancer, we don't touch the axilla. So a lot of our patients in early breast cancer who do not have nodes in the axilla which are cancerous can avoid the dissection in the axilla altogether, and they can avoid the risk of arm edema. Of course, in advanced cancers we cannot avoid it. So I would like to tell you a little bit about the new techniques of oncoplasty. What exactly are these techniques? These are things which most of the people are not aware of, and very few people in India are practicing. But now more and more surgeons are taking interest, and we are a growing tribe. So what we do in oncoplasty is that we use the plastic surgery techniques to remove the breast cancer with a good margin and mold the breast. So what we can do is, sometimes the breast is very big, it becomes smaller in size, and breast shape is changed, but shape becomes definitely better than what it was before. So operated breasts look better. Also in small breasts, sometimes the tumor goes, there is a big defect there. What we do is, there is a lot of loose skin below the breast. We rotate that skin, mobilize it and put it and fill the defect. So after the operation, there is no scar also seen. Sometimes it is strange that I have operated on some patients and I myself cannot see when they come back for checkup which side they are operated, because the scars are so hidden, and we have moved the tissue from niche below the breast or from the side, from the armpit, and filled the defect, and the breast look absolutely normal. That is possible only with oncoplastic techniques. So it is really a genuine concern for me. It's a very personal thing for me about breast cancer, and I do feel that every woman has a right to look beautiful. Even if nobody is seeing, she's always seeing herself in the mirror. So she's the best person to look at herself and love her body. She should be confident, she should look beautiful, and she should not feel ashamed or scared of the fact that she is a cancer survivor. Why do breast conservation? I will ask, why remove the breast if it can be preserved? Because here in Amrita, our surgical team, we are dedicated to understand and appreciate the concerns of a woman. It may not matter to anybody in an Indian setting that a woman loses the breast, but for a patient to look at herself in the mirror, and a mastectomy or a loss of breast is a lifelong reminder of cancer and a lifelong reminder of the disease which can take her life. Whereas people who have undergone breast conservation, and especially with oncoplastic techniques, sometimes even forget they ever had cancer. So in Amrita, our team is dedicated to giving the best cosmetic result to all our patients, whether they have cancer or they have benign disease. We want our patients to be very happy, satisfied, confident, and satisfied in their body image. Coming to other aspects of breast cancer, like radiation. Many women say we don't want conservation because we don't want to take radiation. Radiation has many complications. When I ask them what are the complications, they don't know. So let me tell you, radiation has no major complications. Only the treatment takes about 3-4 weeks, and in our institution we have got state-of-art machines which protect the lungs and the heart. So there is no radiation to hunger heart. We have very focused, we give focused radiation with our advanced machines, and only the breast gets radiated. So radiation is perfectly safe. Also with chemotherapy, patients have a lot of issues. We lose hair, we lose this. Yes, we have got scalp cooling available here, so patients don't lose hair. Also we have designed a boutique where our patients of chemotherapy are losing hair. They can give their measurements here, the wig will be delivered here. We also have got breast prosthesis, and with the full setup for the patients to be able to avail of this facility. So even patients who've undergone mastectomy can use prosthesis, they can have secondary reconstruction. We actually are dedicated to having good quality of life for all our female patients, and we want all women to be very happy. That is our goal.